You're listening to the Veterinary Innovation Podcast. You're listening to the Veterinary Innovation Podcast. We interview innovators in this space every week. Shawn, why don't you introduce our guest?
Sounds good, Ivan. And if anybody's wondering why we've switched roles, Dr. Ivan has a case of the hiccups now for 48 hours. So we had to switch up the way that we do things here. So super excited to introduce Dr. Scott Weinman today. Dr. Scott is a graduate of Iowa State University College of Veterinary Medicine. Well in practice, he returned to Seattle's University Arbor School of Business and Economics to earn his MBA in Operation Management. His diverse veterinary career spans general and emergency practice management, board service, corporate training, relief service, and over a decade of field-based professional services as a veterinarian. He's an avid traveler, outdoor enthusiast, downhill skier, podcast host, an amateur mixologist, and a chef, just to name a few of his hobbies. Scott, welcome to the show. Super excited to have you here.
Thank you, gentlemen. Happy to be here.
So it looks like we're going to talk about time management in the veterinary space. Why is it so important to you, Scott? And why don't we start there?
Well, I think probably like many of our listeners who are high achieving and perfectionists, we also tend to be procrastinators. And originally, way back in veterinary school, I realized that if I didn't have some, sort of some process for every one of my courses, for everything that I was doing to reach my goal of being a veterinarian, that I felt out of control. So it was in veterinary school that I really started to learn some of these original techniques. And it was that, that sort of love, creating small habits, changing small changes in my daily life that really results in a lot more time and me being a lot happier and feeling more in control of some of these things that we can't control. So that's what started it. And then through my MBA, it was really eye-opening to me. An MBA is just like a medical degree, is a way of thinking about things, learning to think like other veterinarians, learning to think like other MBAs. And I found it was a very difficult transition for me to switch from medicine, which tends to, take all these clinical signs and reduce it down to one diagnosis, versus the MBA where everything sort of expands. And I found my place in the MBA program in operations management, which is in my mind very similar to medicine. It's sort of diagnosing, it's making small changes that affect the outcomes. And so that's how I got here. And more with the crisis in veterinary medicine, I see this as a way to train young grads in some basic skills and new residents that really can make a difference in their productivity and also ultimately in their job satisfaction and just their happiness with their lives and their career choice.
Well, that makes a ton of sense and stands to reason. So I guess I want to double click a little bit more on your day to day. So you've got this podcast. It sounds like you're super passionate about time management and like helping people with those skills. Mm-hmm. How do all of those two things tie together with what your day job is, and what is your day job?
My current day job is as a professional services veterinarian with a veterinary corporation in the US. So that's what I do as my 9 to 5, so to speak. But the podcast has been a labor of love. We started our podcast, The Vets Unleashed, with my co-host, Dr. Mike McClenahan, back in 2019, pre-pandemic. And so obviously, I think you guys was your podcast going at that time as well? Yeah. So you definitely know it changed everything, the way we recorded. And so it's truly been a labor of love. I guess for me, it's I have this passion for time management, and seeing a lot of the conferences and a lot of the folks that are currently out there speaking on time management, they're not veterinarians, right? They're management gurus. They are accountants. They're people who like to give you the quick tips and, here's an app, here's something to do to manage your email, but they're not veterinarians. And so many times, time and time again, when I would talk about to veterinarians, to veterinary technicians and veterinary paraprofessionals about time management, we talk about, some of the essential skills, and everyone knows, you have to have an awareness and a respect for time is a limited resource, and everyone knows these adaptation skills, right? This idea that, how to do, maybe to-do lists don't work, and how to time block and all those kinds of things. And we love to learn about those things, but how many times do we leave a conference, coming back to our practices thinking, I'm going to make this one change. This one change is all I want to do. And it never gets done, right? Those are very limiting. And so many of the vets and vet techs would say to me, yes, but I can plan. I can have the best time management habits in the world. I step on the treatment floor or I step into the first room and there's chaos. A hit by car comes in. My last practice was an emergency and chaos erupts and you feel out of control. And I look back to some of these essential skills of really managing that chaos, and skills that I started learning in veterinary school, that I continued through my MBA, and that I use in my professional life, both clinical and also, in my professional life as an industrial veterinarian. And I really saw a need for these discussions to be had and for these skill sets to be shared with our colleagues.
Well, why don't you unpack for us this sort of top 5, if you have them, skills that the veterinarians should have? Because just like you said, everybody has a plan and a calendar and a task list. And as Mike Tyson said, everybody has a plan until they're punched in the face. So what happens and how should we manage when we get punched in the face at work?
Yeah. Or their ear bit off, right? Too soon. Yeah. So I think of it more as a process, and we all come into this with different skills. So I don't think there's essential time management skills that people necessarily need to have. Certainly, if you have difficulty like I do in creating habits, there's some great places to start there. But really for me, the focus on, my team, so the Vets Unleashed, my team, Dr. Mike and I have developed a workshop for folks to really sort of workshop the common challenges that they see, and then a system to deal with that. So if we're talking about, the classic essential skills for time management, it's 3 A's. First is awareness. It's just the basic understanding that time is a limited and valuable resource. And for that, one of the things I really think about, and which was really helpful for me, is what they call the power of 1440. So everyone has 1440 minutes in their day. And whether you're Dr. Ivan or Warren Buffett or Bill Gates or a practicing veterinarian, we're all limited to that. No one can buy more time. It's going to march forward. It's going to keep happening. And so we're not really managing the progression of time. We're managing how we react to it and how we relate to it. So, thinking about that power of 1440, if you put it into a 10-hour workday, that's down to 600 minutes, right? So how many times during the day do we walk in and someone says, hey, doc, do you have a minute? It's never a minute. It's always 10 or 15 minutes if it's another doctor usually. And already that's 2.5% of your work shift gone. So really, first step, I guess, if there are steps, is having a real, coming to a place where you fully understand and embrace the concept of time as a limited resource, and how important that is to your daily, to what you do each day to help patients and work in a veterinary practice. Number 2, so there's awareness, and then there's arrangement. And that's all the things. That's essentially, time management, planning before something happens. So, arrangement is all the fun stuff. And I love to talk about that. I've got a whole lecture on emails, or having your notes done, having all your medical records written by the time you leave your shift every day, which is something as an ER doctor I always did. But my first few years in practice, I would sit for hours just, writing. That was back before Talkatoo, before, a lot of great tools that can help us, just sitting for hours after my shift ended writing. So that's where all those fun things come in: managing email boxes, time blocking, adapting and planning for life to have the clearest path through our day. But really where we as veterinarians fall flat is in the 3rd A, which is adaptation. And that's where we have to adapt to changes that are unexpected. So it was not uncommon for me to walk into my swing shift at the emergency room and I could have every plan in the book. I'm going to, at the top of every hour or at the start of every appointment, I'm going to take 5 minutes to at least write my, my presenting clinical signs and my differential diagnoses into the medical record. So that'll assist me in closing these out and getting all my records done. And then you walk in and there's a hit by car and 2 seizuring animals and they're doing CPR and there's only 2 or 3 doctors on the floor. And you get pulled right into that and you're just in this period of chaos. So really, where I'm focusing on time management, it's fun to talk about all the other things, but really to increase our job satisfaction and to be more productive as veterinarians, and those two I truly believe go hand in hand. That's where contingency planning and sort of stepping back when you're in the middle of the chaos and using some basic tools to get there is really valuable.
So, Dr. Scott, very fascinating. I mean, me and Ivan both run companies. I've got a team of over 50 people now, so it's busy. Time management is something that's kind of like core to all of the things that you need to do as the CEO of a company, and you learn it normally trial by fire. I remember early in my career, I had no idea about it, and I wasn't necessarily the best guy to work for in the absence of those basic time management skills. So I think a lot of people that are probably going to end up listening to this episode are going to be able to relate to the conversation that we're having. If people want to start, what's the first thing they do? You said you talked about a course that you're coming up with. Is that a good starting point? Is there a book or something that people should gravitate towards if they want to flex that time management muscle?
Yeah. It's very interesting. The specific piece that I'm fascinated by, there are not a lot of resources out there. There's a book, specifically dealing with work interruptions. So, how they study, if you look at process flow, they actually look at, we don't consider it an emergency or chaos. In the literature, they talk about work interruptions. And that would probably be the place I would start, typing into Google medical work interruptions or work interruptions and reading some of these things. Also watching for me, I'm going to be on the speaker circuit next year and have, 4-hour management series that covers all of this, including the specifics.
That's the name of the game, right? The name of the game in veterinary medicine. I mean, I've been in hundreds of hospitals. The name of the game is interrupted at work.
Of course.
50 times a day, it's unbelievable.
Some of the studies in human ER physicians show that on average, MDs are interrupted every 3 minutes throughout their shift.
Wow.
So that's way more than 50 times, it's incredible. And it becomes so much a part of our day. It's probably the reason, I don't know if Dr. Ivan feels this way, but everyone will say, should I call you Dr. Scott or Dr. Weinman? But once you've worked in an ER and you're constantly interrupted, everything that starts with Dr. Scott is going to end with, this patient is crashing. What do I do? Or I need to change this drug, or he's still in pain. It always leads to a decision and some of my time. So when I hear doctor, it just makes me sort of cringe.
That's something
I haven't
else.
heard any hiccups from our.
No, I know. I want him to come on so the audience at least has the opportunity to hear one of these hiccups. I see them, I don't hear them. But one of the other questions that I wanted to ask is, so that's happening to me. I'm a doctor. I'm gonna role play the veterinarian.
Sure.
That's happening to me 30 times a day. Give me something, Dr. Scott.
You bet.
Give me something to hang on to here. How do I get them to stop, or how do I manage that better?
Yeah. Well, first of all, again, it goes down to recognizing. So knowing that, let's say, for example, you're treating a patient for something fairly minor in your veterinary hospital, a laceration, something that doesn't need to be done right this second, and an emergency case comes in. The limited data that we have out there shows that if you're that patient or you're treating that patient that the care is interrupted and we have a work interruption, outcomes are going to be worse. Simply by walking away from that case, you're increasing the risk for postoperative complications, for other issues to happen, and the outcomes are not going to be as good. So first of all, I think it's accepting that. But then it's really realizing that there's a lot of things that we can control. And so, like for Dr. Ivan, who's, has probably like me, a lot of years of practice under his belt.
And a severe case of the
And a
hiccups.
severe case of the hiccups, which is neither here nor there. We learn these skills over time, but for newer grads, they really don't have that opportunity. And there's been some limited work with human residents, human medical residents, so humans, but also MDs that are in an ER situation. And what they did is they actually broke up a group of residents and divided it into those who are receiving the skills that you're asking about and those who didn't. And then they followed them through their residency, and they tended to be happier at work, had increased job satisfaction, and ultimately less burnout, less compassion fatigue, all those same things that we're working on. So, some of the skills that we learn really, first of all, it's triaging, which we all do, whether you're a GP practice or an ER or a specialty or hybrid hospital. We're triaging these patients, and we're constantly keeping, sort of a mental note of who's the most serious, who needs our attention the most during those moments, because just like time, our professional skills are a limited resource, some days more than others. And then really it's, always considering, even if it's just for a really brief moment before you move on to something else, or a lot of times in the ER I worked in, we would be having these conversations about another patient, kind of tidying it up as we were starting CPR or getting an airway established or starting fluids on a second patient. So it's considering what is the risk or benefit to that patient. And really, just like I was saying back in vet school, where every course I like to have a plan. Maybe the plan was I'm not going to study it until Thursday of this week, but I had a plan for that course. And just having that plan in place frees you up from worrying about that course then, so you can look at other courses. It's the same with medical patients, really having a patient impact plan. So, we're going to bandage this laceration. This is not an emergency right now. Let's make sure we're touching base with the owners, and let's make sure we have adequate pain control or sedation or anxiolytics, whatever we need to keep that patient comfortable until we can come back to it. That's a plan. That's a patient impact plan, and you're moving forward. Now that may change. You're going to constantly reassess. If that patient started to seizure or really cry in pain, suddenly that rises up towards the top again, and we're going to deal with that. And then really from that patient impact plan, you move into, having this medical plan as well. All those things we talked about, entering it into your system, or having the technician or the tech assistant that's responsible for that case and kind of has a hands-on approach and is working with you, having them know the medical plan, enter it into your treatment board or whatever types of software you're using for management. And then really one of the most crucial steps is whether that team is just you, or it's you and a technician, or a technician and a couple tertiary or just a couple other staff members as well. It's really getting buy-in from the team. How many times do technicians save our butts as doctors? That probably happens as much as we get interrupted, every 3 minutes, maybe, at least in my experience. So really just saying, are we okay? Am I missing anything? And make sure the team has buy-in in that plan, and then moving on and moving your concentrations to that next case.
So, Dr. Scott, I don't think you could have done a better job of pitching your 4-hour course to anybody that's thinking, hey, I'd like to learn a little bit more about how to kind of flex my time management muscle. If people are interested in your course, how do they find out more information? How would they go about taking it?
Yeah, you would find us at thevetsunleashed.com. And you can find out where we'll be speaking in 2024, and also how to contact us for scheduling workshops and individual CE.
Awesome. Well, listen, it's been our pleasure to have you here. As in every week, we run out of time. 20 minutes is a short time. So we've got the same way we'd like to wrap up every week. So the first question that we've got for you is a book, a YouTube video, something that you'd like to recommend to our guests that you've seen along the way that maybe has inspired you or touched something.
Yeah. Well, I was torn between, I'm reading Malcolm Gladwell's new book and I'm enjoying that, but I really I'm on a personal journey to understand my own procrastination a bit better. So I shared with you guys a very, it's a TED talk that was done by Tim Urban. a fellow Canadian, and he just talks about procrastination. And I think it's that first step. It's just like anything else, it's the awareness, right? So it's a great first read, and then you can dive a little bit deeper into what personal, what personal issues are motivating your own procrastination.
Awesome.
And the second question that we usually ask is, well, there it is. Who is another guest that you think would be interesting on this podcast?
Yeah, well, I'm sure you guys are very good friends and stick up for each other. I will nominate my fellow podcast co-host, Dr. Mike McClenahan. He's a stand-up comedian and a GP practitioner, and he talks about virtuous humor and how to use humor appropriately to build bonds with clients and with your staff. What's appropriate, what's not. There really is a science behind that as well. So I'll toss that out to the Bowtie Vet Guy on YouTube, Dr. Mike McClenahan.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.